So to move into our next and final session, we are discussing complementary and alternative therapies. And our speaker is Dr. Peter Smith, who is a specialist cancer services pharmacist at the Adem Crosby Centre at the Sunshine Coast University Hospital. He has extensive hospital pharmacy experience for over 30 years practicing in Queensland, Tasmania, and the UK. Peter's research passion is the safe use of complementary and alternative medicines by cancer patients receiving chemotherapy treatment. Welcome, Peter.
Okay, thank you. Okay, it's great to be here to speak about the safe use of complementary medicines during treatment. So I'll do a bit of background and look at some safety issues. I've got some recommendations. There'll be some cautionary tales. And after speaking to Erica and Lisa, we'll talk about cannabis because that's on the top of a lot of people's minds. Okay, so complementary alternative medicines are a diverse group of treatments and products that are not normally considered conventional medicine. So complementary medicines may be biologically active. So for example, herbs, vitamins, minerals, that sort of thing. But also complementary medicines or therapies can be mind-body, sort of such as massage, meditation, music, and the like. And straight away, one can see that complementary medicines that are biologically active are the most likely to cause some sort of complication if you're taking it at the same time as receiving conventional treatment. People who choose to have a look at complementary medicines are no fools. Really, if conventional medicine doesn't give you all the answers that you're looking for, it's a logical thing to look elsewhere. So what is out there, for example? And this is where there are two roads. There's a very dark road when you're looking at alternative medicine, which I'm meaning you forego your proffered conventional treatment and go down to just having something instead. But most people, in my experience anyway, are looking for, well, I'm going to have my conventional medicine, but what else is out there that I can enhance that and make it better for me? It seems that certainly in the cancer realm, everyone's got an opinion, and you may be getting good and probably mostly bad opinions from families, friends, etc. My big issue is if you get someone that's worrying you, if you're actually looking for your own treatment, taking your own decisions, sometimes it's the anxiety of having someone else saying you should be doing this or should be doing that. So if you can keep away from those sorts of people, certainly during a treatment, that is a good thing. This is a bit of an untidy slide, but this is a replication of a peer-reviewed journal article looking at anti-cancer activity in natural products. So there are hundreds of thousands of natural products which exhibit an anti-cancer activity. And that's when we're talking about that, that's in the lab, that's tested on cells, and sometimes it's done a little bit more onto animals. So be assured the greatest minds in the world are looking at these interesting new products. And the trick is, or the difficulty is, or the excitement is that to try and bring these products into being tested on humans, and a lot of humans, to good effect. So just keep that at the back of your mind. This slide is just to show you that we're not all Philistines in the cancer care area. This is some of the audience may well have had experience with vincristine or etoposide from the periwinkle plant and the mandrake. The paclitaxel is more from solid tumour, but there it is. So these are natural products that have made their way through scientific endeavour to be tested on a lot of humans for a certain disease, and is now part of medicine. And just to keep in mind too, that these are actually given as intravenous injections for maximum effect. So it's my view that it really is, it's not so much, it should be the patient's choice on whether they use complementary medicines at the time of receiving other treatment. And as long as it's safe to do so, I don't see a problem with it in any way. So that's where I've dedicated most of my research and pretty much the last 20 years of my life. This is a very crude slide of what I've tried to replicate there is the therapeutic, the narrow therapeutic index, which is what we're trying to achieve with dosages of chemotherapy agents. So it's sort of looking for the sweet spot, I guess. And the sweet spot is I'm just trying to represent it there with the yellow in between those two lines. So that's where it gives you maximum effect with the least side effects. And what we do know is that biologically active agents, including other drugs as well, but certainly herbs may influence that sweet spot. So it may alter the metabolism of drugs by increasing the side effects, so going above the line, but even perhaps more importantly, they may reduce the efficacy, which is exactly what you don't want at all, because as you know, your dose is, the height and weight, etc., everything is carefully measured for you, and you do not want anything to wobble that around for you. To that end, we did here at the Sunshine Coast, and I, with some other colleagues, we noticed that there was a need for our patients. People are getting a lot of advice as well, but also, what else can I do at the time I'm receiving chemotherapy? So we produced this booklet, which is in its 5th edition. So I'm just going to, so in the booklet, it's as I said before, people are looking for what else is out there, and we want to sort of try and meet that, not just patting you on the head to say, look, don't have this and don't have that. These are the reasons why you can do this, but maybe not do that. And I keep on getting back to the mind-body cam, which is really the time. And as previous speakers, just the last one too, that's where it's at for combining with conventional treatment to good effect. This is there's a few tables in this brochure. The ones that have made the cut sort of in the table there, there's a type of evidence which we call above standard care. So it's sort of more or less you have your standard care, but if you have this something else intervention, then there've been some studies to say that people did a little bit better. So that's why I've included that into these tables. And the biggies really are sort of the relaxing into your conventional care. So the meditation, you don't have to be a monk living on, in isolation on top of a mountain to meditate. To my mind, it's whatever you do when you look up at the clock and 3 hours have gone. So, it could be a jigsaw puzzle, it could be a movie, it could be anything, just to keep your busy mind off things. And the other one too is the imagery and relaxation. So if and when you're having treatment, it's good for you if you can sort of go with it, sort of invite it in. Some people can imagine ninjas coming in and seeking and finding rogue cells, and then you can tell them to get out. I know that I'll just reinforce, yes, I am a pharmacist. I'm getting a bit weird, I know, but these things do have reasonable evidence, and it's certainly much better than sort of putting the fingernails in the chair. So if you go with it, and the relaxation as well is very good for you at the time of receiving conventional therapy, and then you can mix up some music and etc. too, and that's all free. There's another table as well, which we try and explain why there's some complications with supplemental antioxidants, certainly herbs, Chinese herbs, and mixtures of, and why we think it's not such a good idea while you're having your treatment. This is a bit of an untidy slide. I used to have a third table, which I've completely got rid of now, because by the way, yogurt's fine, by the way, but probiotics now, it's been shown in some recent studies that if you're on an immune therapy, so then some of the new kids on the block, then it actually, if you take a supplemental probiotic, it actually diminishes the effectiveness of it. And conversely, who'd have thought a good diet actually promotes the therapy. It actually increases your bang for your buck with immunotherapy, which and all I'm talking about is whole grain fruit and vegetables. I mean, and the science behind that, if you get all that intake through a good diet, it actually creates a more diverse microbiome, which in turn helps with your immune therapy. So, and look, and ginger, I was being a bit picky. They found that ginger may alter the absorption of some other tablets at the same time. But I've sort of, I guess the point I'm trying to make now too is that I'm not, the thing is not so much like probiotics had some pretty good literature behind it before, but it's sort of some, and I can take that up to today. So things that you may want to take today and we're pretty sure it's safe may not be tomorrow. If that makes sense. And certainly with some of the new exciting therapies coming in, you don't want to be mucking around with that. And especially when you can get just as much benefit from the mind body at the same time. I sort of recommend in the book that some really good other places to look at. I'm sure and Erica can pass it on if you're not familiar with these two sites that I can recommend. Okay. So snake oil, beware. So when I talked about the people when they're sort of looking for something else, if you're looking at alternative medicine, nothing has changed. This is a legit advertisement from the 1800s. And just the alarm bell should be ringing. Sometimes this really is snake oil, a guaranteed cure. If you're looking at on the internet for something else, that's an alarm bell that should be ringing with you. And this is sort of a guaranteed cure for rheumatism, etc. Look, get out the credit card, 50 cents. And don't forget, if you buy rattlesnake oil, another snake oil, deafness as well. So what I'm getting at, if you're looking on, if you've gone too far, you're probably on the wrong Google track if you're hitting stuff like that. So cures cancer, but also cures HIV, COVID, and the rest. And down here, you may not be able to read that. What a prominent butcher said from Cottage Grove. I mean, he wasn't just a butcher; he was a prominent butcher. So, of course, if I'm looking for solar panels or a new shed, I consult a recently retired footballer or a cricketer. The other thing too that snake oil people or alternative medicine people like to spruik is that it's the association. So the cock crows, the sun gets up in the morning. That's an association. The sun, I mean, the rooster probably thinks that it's got the sun coming up, but certainly they're associated events. They just happen to go together at the same time. So it's not, the rooster doesn't cause the sun to get up. I drink my urine every day and I haven't got COVID. It's sort of Auntie Marge did blah, 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 blah. So just, I mean, yeah, enough said. Okay, so I think we'll move on to cannabis. Okay, so it's been, as these slides will show, it's been used forever, pretty much. It started off in Central Asia, and something that's been used for thousands of years doesn't necessarily mean that it's still going to be any good for you, but it certainly it's been around for some time. And I know this is my talks about complementary alternative medicines, but cannabis was part of the pharmacopoeia, certainly in the towards the late 1800s. So what happened was a UK doctor brought it out from India, the Gunja, and there it is. So it was on the pharmacopoeia in Europe, US, and the UK. So I mean, that's one hell of a cough mixture there. And of course, it's sort of it's given to infants the whole bit. And even there, that's one of the premier journals, medical journals still, the Lancet, 1890. Here we are talking about cannabis in sleep, pain, and epilepsy. So it's been used for some time. That all unfortunately crashed to a halt in about the 1930s. So here we are. Right up until then, cannabis was part of the normal arsenal that some doctors would prescribe and pharmacies kept. But For political reasons, I don't have time to really go down there, but apparently this is, I've been reliably informed, this is one of the worst movies ever made. But you can see how this innocent young lady turns into someone, well, I'd say really interesting there. But it was completely, the propaganda was thick. And what happened at first, they made cannabis more expensive. They put taxes on it. They stopped the doctors prescribing it until right through until it was lampooned right through until 1970. Nixon made it a prohibitive substance, which meant it was sort of off the. It was ruled out. So unfortunately, because of all this, but now it's come back. So we're looking at what's happening with cannabis now. So the unfortunate thing about this is that we lost, 80, 90 years of experience being used by humans with cannabis. So, and I'm a bit worried right at the moment is that there's a bit of a mythical quality sneaking back, but certainly there's something about, so the Chris O'Brien Lighthouse has been doing some really encouraging work on chemotherapy-induced nausea and vomiting. The MARTA in Brisbane down the road here is looking at other like appetite stimulant. You get the munchies with cannabis, also pain relief, et cetera, et cetera. Now, okay, so what about treating cancer? So as getting back to that slide, cannabis is one of the hundreds of thousands of natural products that has an anti-cancer activity. It has been, at the moment, there's been some research, there's some interesting, very early trials done on brain cancer, glioma, which are brain cancers in conjunction with conventional medicine. There's been some animal studies, certainly on lung cancer. And so there's some interesting things coming through at this moment. So, but we can't, don't forego all of your conventional treatment to hunt out cannabis instead as a cancer agent, because it's not, the evidence isn't there and we won't know. In fact, we don't know. Cannabis has so many different active ingredients as not just the THC and the CBD. Just quickly too, if you choose to have cannabis and it's okay with your treatment, it is like other drugs. It can interact with other drugs, and that doesn't mean don't do it, but it just means that there's the same precautions that go on with cannabis as well. So here we are. So we're at the stage. So so it's certainly, I think it's got enough evidence to commend it for nausea and vomiting. Certainly, as in pain reliefs, especially in conjunction with opioids, it seems to have a synergistic effect. So the sum of the two is sort of better than the one, and certainly, sort of it might decrease a bit of the opioid use as well. Appetite stimulant as well, and you probably add into that for sleep. But notwithstanding, don't forget that it has side effects, and it does have interaction potential. And they have done a study too. Here, immunotherapy again. They found that a trial, it was a melanoma trial on patients receiving immunotherapy, and they found that patients taking cannabis as well as receiving the immunotherapy had a slower rate of response to their cancer treatment, which is probably not what we want. That's yet to be decided on what the significance of that is, but we'll just hopefully there'll be a lot more studies done very soon. And that's me.
Thank you so much, Peter. I think this is a very hot topic as well too. I think that cannabis oil particularly is something that quite regularly gets asked as well too. And I think what you also said as well too about the advice that then comes through by all of the well-meaning carers and friends and the person on the bus who knew someone who had cancer as well too. I think being able to navigate that and trying to filter that advice to what is actually true and relevant and medically based is quite challenging sometimes for people. So I think that it is really important to ensure that you are getting advice from correct sources as well. So I think that's really fabulous. So people are coming through with questions as well too now. So cannabis is very difficult to officially get and apply for medically. Are you able to shed some light on the medical application process?
Yes, and it's very expensive too. It's disappointing. They're trying to look. There are two. It's all about business as well. For my venal colleagues in Chemist Warehouse, they've signed up a deal with I think they're going to send it. They're going to sell it over the counter, which is sort of pretty small doses. Well, I always get in a low blow quickly, but it's hopefully. I think that, and that's why Chris O'Brien Lighthouse. I think that the evidence is coming in. It's as I say, it's a real shame that we've had to sort of go back to basics, in inverted commas. Canada is out and away. They've been producing very good products, and to even the spray and things like that. But there's now some GPs I think can go online and buy the oil online and things like that. I don't think it's not going to come anytime soon that they're going to approve cannabis for the treatment of cancer. I'm not sure whether am I answering the question?
Yes, no, you are. I think it's important as well too that people know that you can talk to people at your hospitals about how to access cannabis legally as well too. Most of the time you do need a referral to be able to get it for clinical indications as well too. And it is subsidized, but it is still expensive as well. So I think and I don't want to go sharing locations and things like that, but there is quite a lot of facilities around that do specialize and have that option. So it's just about asking your key contacts at the hospitals and things how to get something specific or close to you. Is there any other questions, or someone's just heeded your advice about probiotics and immediately stopped them? A question specifically about a drug interaction, cannabis and acalabrutinib. Is that okay?
Okay, tyrosine kinase. As far as I know, yes.
We can redirect back to your
pharmacist. Can I get back to you? I better see the pathway because it does. There's a lot of metabolism there. So yeah, can I put that one on hold? I'll get back to you.
Yes, no, I think that's very fine. And I think if you've got questions about your specific interactions with drugs and anything that you want to take, I think the key messages are, please don't hesitate to discuss them with the people at your hospital settings that are prescribing your treatment. Discuss them with your pharmacists, discuss them with your doctors, so that then you are aware that what you're doing is safe as well too, and that you have got that peace of mind as well. So I think that is very important.